first of all, I want to thank you for coming on. It's always great to have guests, and you've got I think, an interesting background story. Where are you located? First of all, I'm not even sure.
I live in New York City.
You're in New York. I see you got the Onnit shirt on.
Oh yeah, yeah.
I got to go to their headquarters. I did an interview with was it Kyle Kingsbury, I guess. And,
oh, nice.
So that's a pretty nice facility out there in Austin, Texas. So, Jason, you go by, I think it is a Ketopocalypse. That's your handle on social media, or at least on Instagram. So kind of
that is correct. Yeah, you're one of the few people who actually pronounced it correctly.
Okay, well, good. So tell us, can you just tell us a little, maybe take 5 minutes and tell us a little bit about your background, if you don't mind?
Okay, sure. I am a registered nurse. I've been practicing nursing for about 11 years now. I'm someone who has struggled with obesity, depression, anxiety, arthritis for the majority of my life. I also tried veganism, or the vegan diet, twice. The first time I tried it a year and a half. The second time I tried it for a year. Both times I failed miserably. From there, I transitioned into a ketogenic diet. After the ketogenic diet, I transitioned into a carnivore diet. And actually, it was maybe about 2 or 3 months before you guest on Joe Rogan's podcast. And since then, I've never looked back.
Where I've got a little accent. Where are you originally from?
I'm born and raised in New York. My family's West Indian, from Barbados and Bermuda.
Okay. So yeah, I was going to say I thought I saw a little bit of an accent there. So tell me about. So you said you tried a vegan diet twice and you failed. What made you fail? Because a lot of people say it's the healthiest diet, and some people have success with it. So why do you think you failed that?
I failed it because my depression worsened, my anxiety worsened. I was losing weight, so in the mirror, I thought things were working. People were giving me compliments, but I kept feeling miserable, absolutely horrible, day after day after day. The arthritic pain that I had in my joints worsened. My insomnia worsened. I felt fatigued, very lethargic. I didn't have enough energy to get out of bed sometimes. Like, I really had to force myself to rely on caffeine just to get through the day.
And I guess you try to adjust the diet, because a lot of people will make the point that you just, you weren't doing it correctly. You weren't eating whole foods. Were you eating, was it a well-balanced diet with proper supplementation and all that stuff?
Right. So the first time I tried it, I made the typical mistakes that most vegans make. I was eating Oreos, I was eating French fries, because that's classified as being vegan. The second time I tried it, I ate everything organic, everything local. I included organic seeds, fruits, veggies. I did organic fruit and vegetable juice fast. I did everything that I thought I was supposed to do as well as I could do it, and I still failed horribly.
Now, did you have? Jason, how old are you, by the way?
I'm turning 34 next week.
So you're relatively young when all these things are going on. Did you have anybody sort of guiding you and suggest? Was there a physician involved that sort of led you to that, or did you do everything all on your own? I mean, as a nurse, you're obviously surrounded by medical people, I would assume, correct?
Mm-hmm. Right. So no one actually. Well, some of my coworkers guided me. They happen to be vegans themselves, so I just followed their advice. They gave me a few books. Largely, what was responsible for me attempting a vegan diet were these 2 documentaries that I saw at the time. One was Earthlings, and the other one, I believe, was Fat, Sick, and Nearly Dead, and Forks Over Knives. Those 3. After watching those 3 and then hearing, the dogmatic advice from my coworkers, I decided, this is the right diet for me. But otherwise, no, I really didn't have anyone really guiding me on how to go about this diet.
Yeah, I'd seen the Fat, Sick, and Nearly Dead. That was basically the guy that went around juicing for a while. But
right.
And then I guess there was a Ukrainian terrorist that demanded the Ukrainian government recommend the Earthlings film just the other day. He took a bunch of people hostage with guns and grenades. So
right, I saw that.
That's kind of a little bit bizarre. So how, because many of us, have gotten to the carnivore diet, you know, there's obviously it's gotten a little more popular and people have heard about it. But 3 years ago, it wasn't as well known. I would say. How did you come across it? And what made you want to try that?
Well, I was already on a ketogenic diet at the time. I was eating mostly beef, eggs, avocados, spinach, and cheese, pretty much. I fell upon this forum called Zero Carb Zen, and I remember reading some of the articles, and basically article after article was pretty much telling me that you don't really need vegetables or fruits to live healthily. You don't need seeds, you don't need nuts, you don't need any of that. In fact, not only do you not need it, is can actually be harmful towards your health. When I first read it, I thought it was absolute nonsense. I was comparing that with what I was taught in nursing school, everything that I was taught with regards to making sure you have enough fiber, making sure you're eating your fruits and veggies, your 8 to 12 servings of whole grains. I was trying to compare that with what I was reading in these forums. But then I also thought, I'm already eating beef, I'm already eating eggs, I'm already eating cheese. All I have to do really is to take out the avocados and spinach, and I'm pretty much a carnivore. So I decided, you know what, let me just give it a shot. What do I have to lose? I figured I'd try it for a month. And I've never looked back. I never looked back. I am so grateful that I actually found that blog. I really am.
Yeah, a lot of people would say that, on a carnivore diet, it's just because you're cutting out the junk food, but you already were there. I mean, you were already at a point where you weren't eating junk food. You were eating meat plus a few select vegetables. And I mean, because a lot of people, the criticism is, why can't you eat meat plus vegetables? And I don't think any of us here, including the ones that were former vegetarians and vegans, and we have many of them in this community, but I think all of us tried that route already. And so what was the biggest things you noticed when you eliminated the avocado and the spinach and just went to, beef and eggs?
Number one was my depression cleared up. My anxiety reduced dramatically. The arthritis in my knees and my left shoulder was almost non-existent. Also, my digestion improved dramatically as well. I think getting rid of the spinach in particular definitely made an improvement to my digestion.
Yeah, we see, it's kind of interesting. I don't know if any of you guys are familiar with Mark Sisson. Many of you are. And I sat down with Mark, and, he used to recommend these. He called it the big ass salad, salad the size of your head. And he's no longer doing that anymore. He's kind of come to realize that maybe the salads aren't all they're cracked out to be. And maybe, just trying to put down mounds and mounds of, indigestible leaves is maybe not the best thing for human beings. So
exactly.
I think that's interesting. Tell me a little bit more about, you said you're a nurse. What kind of nursing do you practice? Are you in an inpatient hospital, outpatient? What's the setting you're in?
Right, so I work in an inpatient hospital, mostly in med-surg. Occasionally, I will work on a step-down unit, but maybe 80% of my practice is in med-surg nursing.
What percentage of your daily census, the patients you take care of, do you think would benefit from lifestyle intervention? How much of that is people being there are there because of bad lifestyle?
All of them. I say at least 75, 80% of my patients are diabetic. The big three that I see are diabetes, hypertension, and coronary artery disease. Those are the three most common diagnoses that I see amongst my patients.
And I'm sure the hospital provides a carnivore diet for the patients, correct? Is that right?
Oh, God. There's been numerous times where I've had patients come to me who are diabetic, and they'll complain. They say, at home, my blood sugar is fine. It's in the low 100s, sometimes even mid to high 90s. But when I'm here, my blood sugar is 200, 300 plus. I don't get it. And I'll tell them flat out, it's the food that we're serving you. Where I work, a diabetic tray is, you can get pancakes, applesauce, grits, crackers, but because they give you sugar-free syrup, that's considered a diabetic tray. And it's absolutely ridiculous. So now we're feeding patients these diabetic foods, and now I have to run to give them an excess amount of insulin to counteract the food they just ate, when really they could just eat foods that are more tuned for the endocrine system, that's not going to allow or need so much insulin to be secreted. But I think hospitals just feed patients foods that are cheap, that are affordable, and that are subsidized by the government.
Yeah, that's one of the frustrating things, and I know I don't know if you're aware of Nina Teicholz. I mean, we've had her on, and she's
Yes.
been really trying to impact the use of our dietary guidelines, and it's almost like a fool's errand, because I think they're just, unfortunately, I think that system is so, I want to call it corrupted by vested interests in, the grain subsidies and what we do with these big industries that profit on that. And so, and what you're talking about is absolutely true, because the hospital food, the school food, military food, so many of our guidelines are based upon this and what we recommend. Do you find, what percentage of, because I'm sure on med surg, surgeons and internal medicine docs and some of the specialists, what percentage of them even think about nutrition when it comes to their patients, or any of them even talking about nutrition at all?
Very few, Sean. And if they do, they teach outdated nutrition. It's even something that I'm mandated to do. I have to teach my patients to follow a low-fat, fat-free diet. There's been times where I've even been disciplined for telling my patients, hey, if you want to come off the statins, if you want to come off the insulin, here are some steps you can take, here are some foods you can eat. And some doctors that overhear me saying this have actually pulled me to the side and very upset, telling me, you're not giving them sound science, you could be suspended, you can have your license revoked, so on and so forth. So you rarely hear doctors talking about nutrition. And if they do, it's the standard mainstream advice that we've been hearing for the last 50 years now.
Yeah, and that's one of the reasons, we're trying to get these clinical studies done on this diet, and that's why it's so important. So, we can hopefully impact the advice that physicians are giving, and hopefully some of them will actually be open to actual scientific studies, because right now, as you know, we have a large community of people that are obviously getting healthy, and it doesn't match up with the mainstream nutritional advice, and so it's very difficult to get this to grow sort of beyond organically without the studies being done.
Right.
Do you have any? Tell me about where you're at right now, because I've seen you some pictures, and you've gotten fairly pretty lean, and what because when you said you're on a vegan diet, you lost weight, but what's the difference between losing weight on a vegan diet and maybe losing weight on a animal-based diet?
Right. So when I was on a vegan diet, I was dropping weight pretty quickly, but I was dropping both body fat and muscle. And at the time, I couldn't tell the difference. I didn't really care. I just liked what I saw in the mirror. I lost weight pretty quickly on the vegan diet, but I was basically wasting away. I was almost emaciated. On a carnivore diet, I was burning pretty much body fat, to be honest. Of course, at the same time, I combined it with fasting, and also I was lifting weights in the gym. But what I noticed was I was shredding body fat, and I still had energy to go and perform various tasks throughout my day.
Do you, outside of work, do you participate in any exercise activities? Did you notice a difference in your capacity to exercise, strength, and any of those types of things?
Right. Well, prior to the lockdown, Sean, I would visit to the gym maybe 4 to 5 times a week. I definitely noticed an increase in my strength. I noticed an increase in my stamina. I used to have severe problems with dizziness and palpitations while in the gym. That went away. I just felt this overall sense of being energetic. I didn't feel easily winded like I did when I was on a vegan diet. And I believe it's mostly because I'm fueling my body with the nutrients that it needs. On a vegan diet, you're losing weight, but you're wasting away because your body's starving. It's begging you for the nutrients that's not found in plant matter.
So this is a kind of the question that people are always interested in, myself too, to see what other people have and what they do successfully. So how would you describe your quote unquote carnivore diet currently? Does it lean to a higher protein approach, a higher fat approach, and maybe what specifically are you eating on a day-to-day basis?
Okay. Well, the first 2 2.5 to 3 years, well, the first 3 years, I'll say, I was on I guess both high protein and high fat, a higher protein to fat ratio. Within the last month and a half, I've been focusing on implementing a high fat, moderate protein approach. I actually prefer that method more. I feel more energetic. Um, I feel I have better mental clarity, better focus. Typical things that I'll eat is usually beef, beef fat trimmings. I'll eat organs such as lamb brain, beef heart, beef liver. Occasionally, I'll have some bone marrow. Occasionally, some raw salmon, but I pretty much stick to that.
And since you kind of made the shift to maybe a higher fat approach, what was the motivation for doing that, and what have been the results, or is it too early to say?
Well, I think given my years of abusing a SAD diet and following a vegan and vegetarian diet, I'm almost certain that I've done some kind of damage to my gut. And I think, when you have a damaged gut, it may not be a good idea to eat 3 or 4 pounds of meat per day. And that's basically what I was doing. So I thought, maybe I should reduce my protein, increase my fats, and allow myself to get into a therapeutic range of ketosis so that my gut can heal. And I've actually been noticing that within the last month or so. I've noticed that I'm able to tolerate foods much better. My digestion is nearly flawless. I can sleep less hours and I still have the same amount of abundant energy throughout the day. This is all within the last month. So I don't know if I'm going to continue this method forever, but I'm definitely using it as a means of healing my body even further.
Are you measuring your ketones currently?
Right. So I measure my fasting blood glucose and ketones. I measure it pre and post meal and right before bed. And I'm usually, I would say, between 2 to somewhere as high as 5.5 in ketones. And my blood sugar can range anywhere from 68 to about 84, 85.
And because as you go by Ketopocalypse, I assume you were doing some of this keto stuff and measuring ketones back before carnivore.
Right.
What were your glucose levels like maybe back in the day before you I don't know if you measured it, but were you having issues with that before? Were you pre-diabetic or anything like that?
Yeah, so I don't think I wasn't officially diagnosed with pre-diabetes, but I noticed that my fasting blood glucose was always 95, sometimes 99. My blood sugar sometimes was even in the low 100s. I actually had a blood panel drawn this past February, and my fasting blood glucose was 95. And although, according to mainstream medicine, that's considered within normal range, I felt like my blood sugar should be within the 70s if it's a fasting blood glucose. My A1C was fine. I wasn't, pre-diabetic. But I noticed now, since I've adopted a higher fat, moderate protein approach, my blood glucose is usually low 70s to mid 80s consistently.
Yeah, and guys like Richard Bernstein, Dr. Bernstein would agree with you. He'd like to see people, keep their blood glucose, certainly maybe in the 80s, low 80s, typically, as a type 1 diabetic, which he is. But so there's definitely some people that would advocate a really relatively low blood glucose. When you say high fat, now, what do you mean by that? How high fat? Do you know what your percentage fat to protein might be?
Right. So right now I eat at least 85% fat, 50% protein. I typically get, I would say, around 300 grams of fat per day and around 70, 75 grams of protein. Maybe a few carbs here and there from liver, but that's about it.
And how do you find with 75 grams of protein? Because I don't know how much you weigh, but how are you doing with that with regard to maintaining muscle? Or it might be too early to tell, quite honestly. But do you feel that that's an issue for you?
Yeah, that's actually the main thing that kind of made me hesitant about trying it. Because I come in with this whole bro science background of you eat more protein, you gain more muscle, and I was eating 200 plus 300 plus grams of protein when I first started carnivore. So I was hesitant with reducing my protein down to that amount because I was scared that I would lose muscle. Honestly, I think it's too early to tell. It's only been maybe 4 or 5 weeks or so. But what I do know is that when you are in a therapeutic range of ketosis, you're in a naturally muscle sparing state. So I don't expect to lose muscle. Now, with regards to actually building muscle, that I'm not sure about. That remains to be unseen until maybe 6, 7 months from now.
Yeah, I would say that probably building would be more of a challenge on that low amount of protein. Maintain
Right.
you potentially could. We'll have to see. It'll be interesting to see the experiment. Let me ask you. You said you're from, I believe, you said Barbados.
Mhm.
Family, are they supportive of this carnivore? Do they think you're gone off? They think you've gone crazy, or what's the story with the family?
Well, when I first started keto, my parents thought I was crazy, especially because I was drinking bulletproof coffee. Like I was literally drinking MCT oil from the jar. I was scooping out spoonfuls of ghee. I was putting unlimited amounts of cheese on everything. So they thought I was absolutely insane. But I think once they saw the results that I've had from it and the dramatic improvements to my lifestyle, they are more accepting of it. Will they try it? No, because they love, the traditional foods. But they see that it works for me, and they're much more accepting than they were when I first started the diet.
What are traditional foods in Barbados? I would imagine some
Mhm.
seafood would be in there because I mean, just from the location. But what would be a Barbados traditional meal?
Mhm. Well, their national dish is flying fish. So it's basically like a fried fish meal. They eat a lot of rice, plantains, mangoes, potatoes, yams, things of that nature. It's very heavily grain based. Also some seafood in there, but it's very heavily grain and carb based.
And are you far enough away that you don't go back there, or do your parents ever go back there, or what's the
Mhm.
situation there currently with people's health? Are they struggling with health?
I'm not even sure. I've never actually been to Barbados myself. I have been to Bermuda when I was a kid. My mother visited recently and she loved it, but I'm not too knowledgeable on what their state of health is, to be honest with you. Um, but she continues to enjoy the same traditional foods that she grew up with.
Dan was asking about are you seeing any other lab markers that you've looked at that, I mean, I don't know how frequently you may check those types of things. Blood
Mhm.
cholesterol is one that everybody's always concerned about, like inflammatory markers. Anything else that you see as either an improvement or maybe going the wrong way since you've made changes in both going carnivore and then now on higher fat?
Honestly, all of the results that I saw, the only thing that bothered me really was the fasting blood glucose. The doctor nearly freaked out because my total cholesterol was 232. I believe my LDL was 143 or 153, something like that. But my triglycerides were only 43. So they were ready to put me on statins, and I told them absolutely no. We kind of got into a little altercation. Then I basically left the office because I knew that they didn't understand what I was saying to them. But no, everything else was within normal range. The fasting blood glucose, I definitely wanted to fix. The total cholesterol was 232 or so, but that doesn't bother me at all. Like I want my cholesterol to be high. I don't want low cholesterol.
When you said a significant amount of your patients are people with cardiovascular disease.
Mhm.
What are the cholesterol levels you're seeing? Do they all have high cholesterol? Do some of them have low cholesterol? What's the mix like on that cardiovascular unit?
Yeah, typically they have the same level of cholesterol that I have, to be honest. But I do notice with them is that the triglycerides are extremely elevated, and they also happen to be diabetic at the same time. So I'm guessing there is some degree of inflammation that's attributed to their coronary artery disease. But usually their cholesterol is about the same level as mine, with the exception of the triglycerides.
Yeah, there's a good fellow named Dr. Joseph Kraft who has now passed away, but he basically stated in his book, basically everyone with cardiovascular disease is a diabetic, whether diagnosed or not, and that may mean they they have hyperinsulinemia, or
Right.
maybe their glucose has started to rise, but they sort of have this underlying you know insulin resistance, hyperglycemia.
Right.
Does anyone, I mean, are insulin levels looked at ever?
No, no, it's not even spoken about. I had to learn that on my own. We were never taught in nursing school. You never hear it in the hospitals. The only thing that they focus on is blood glucose. That's it. Blood glucose, A1C. That's it. Nothing about insulin levels.
Yeah, and I would assume, and somebody's saying about C-peptide, which is, just maybe a little more accurate representation of what's going on.
Hmm.
Probably, if they're not looking at insulin, they're probably not looking at C-peptide, because
I
I think
doubt it.
we know to think about that. Um, do you, I mean, how much frustration do you have working within the hospital system and the standard system, knowing what you know, seeing patient after patient, and knowing that possibly these people could dramatically improve their lives if they were just given different information? How frustrating is that for you?
It's very frustrating because I know that what I'm doing is not helping the patient. I'm providing a band-aid approach to the illness. I am using pharmaceutical means of intervening in the diagnosis, which doesn't actually address the root cause. What bothers me even further is that none of the doctors that I work with have any real knowledge or experience with nutritional science, and the little that they do is based on outdated mainstream science. I never hear anyone trying to discuss how to change a patient's diet or lifestyle. It's all, what test can we perform or what pill can we prescribe to not really address the root cause, but just to manage the symptoms. And then those same patients come back 3, 6 months later with the same thing, to maybe have their prescription dosage managed differently, maybe have it increased, maybe prescribe a new pill to manage the side effect that they've developed from the last pill. It's extremely frustrating because, I speak and speak and speak, and I just feel like it falls on deaf ears.
Yeah, I shared your frustration with it within the sort of this our medical healthcare system, which I kind of would call that disease management, and now it's even
Hmm.
disease maintenance. Really, I mean, that's really
Right.
it's even devolved into that. So now you've gotten, you're on social media, you're growing a message out there. How, because it's so hard to change within the system. You see that system that's so dependent upon pharmaceuticals, and it's just not the right form to address these things. So tell me about your social media, and do you feel like you're making a bigger impact from social media than you are as a registered nurse?
Absolutely. When I first started it, I just wanted a place where I can document uh, my weight loss journey, really. And it kind of morphed into something else. I saw that people online were a lot more receptive to the information that I was posting. I saw that they were a lot more open-minded, and many of them are coming online after failing with numerous diseases, numerous symptoms that the doctors or nutritionists or dietitians failed to treat. Um, so I definitely notice I have much more influence, much more impact on social media, because the people that follow me are coming there seeking that information. They've tried the prescription pills, they tried the low-fat diets, the vegan diets. They realize it doesn't work for them. These people are actively seeking an alternative truth. So I believe social media is a great tool for that versus, what we see in hospitals.
Yeah, let me just shift gears a little bit. In New York City, you guys were kind of an epicenter for this coronavirus outbreak. I don't
Hmm.
know how much impacted you were in your particular hospital. My understanding is that is sort of died down quite a bit. Is that what you're seeing? I mean, again, you're on the ground there dealing with this. What has been your
Hmm.
experience working with that particular cohort of patients, or have you done that much?
Yeah, I have. It died down, I would say, around mid-May, probably the end of May. It started to die down. However, I have to be careful with what I say. I noticed that my experience in the hospital didn't always align with what was being said on the news. It was a bit chaotic, it was a bit busy. However, I did notice some things that were happening in the hospital that just didn't make sense to me. And some other nurses and doctors have come out and said the same thing, and they've been canceled or punished as a result of that. But as of right now, it's much more calmer than what it was back in March and April, for sure.
Did you see, the patients that you did take care of that got sick? Did they have anything in common? Were they older, metabolically compromised? Was that pretty much generally what you saw?
All of them had comorbidities. All of them had hypertension, diabetes. They were obese. All of them had some type of past medical history that related to some sort of metabolic disease. To be honest with you, a lot of them, you couldn't even tell that they had this virus unless they tested positive. There were some that had to be intubated that presented with respiratory distress, but many of them, I would say maybe 80% of them, if you were standing face to face with them, you could not tell that they were sick.
Yeah, and one of the things that many of us have been frustrated by, and the sort of the way society has handled this, and there's a lot of, and I don't want to get in too much into should we lock down, should we wear masks, should we not wear masks?
Mm-hmm.
But one of I think the big glaring things that we're missing is the sort of ignoring those that are at risk and maybe trying to improve their health. We
Right.
know that things like blood glucose are very quickly improved by dietary changes, and we know that there's a huge correlation between those with poorly controlled blood glucose and the negative outcomes from this virus. And so, do you see anyone in the community, in the hospital, saying, hey, look, let's maybe work on getting these people healthier as hosts and not just worried about vaccines and isolation, but improving the host factors?
Never, not once at my job has anyone mentioned anything about methods that can be used to improve your immune system. Vitamin D was never brought up. Zinc was never brought up. Exercise was never brought up. Low carb diet certainly wasn't brought up. Everything is centered around an antibacterial, antiviral medication or a vaccine of some sort, or maybe even an anti-inflammatory. But nothing is ever spoken about addressing the root cause. If you know that people with comorbidities stand a much higher risk of being infected or even suffering fatal consequences as a result of catching this virus, you would think that the majority of your attention would be focused on teaching these people methods on improving their lifestyle, improving their immunity, but I've yet to see that happen.
Do you, when you look at the other like healthcare providers, physicians, do you find a bias one way or the other, plant-based, low-fat based versus, maybe a low carb? Is there a certain percentage of providers that are going to say low-fat, plant-based versus perhaps low carb? Is there some relationship there, or ratio?
I would have to say at least 90%. At least 90% will advocate for a plant-based, low-fat, fat-free diet because that's what they were taught. That's what the few classes that they receive in medical school, that's what they're taught. They don't really follow up on the advancements of nutritional science. And we also have these, well, at least for nurses, we have a scope of practice that we have to follow, doctors too, where they're told, if a patient has this diagnosis, this is the medicine you prescribe them with, this is the diet you prescribe them, this is the test you order for them. So we're not really allowed to step outside of those lines.
Yeah, and if you do, what are the potential consequences?
Well, I could be suspended. I could be terminated if it's advanced higher up the chain of command. I could have my license terminated, revoked. Yeah, it's pretty scary. I have to be very, very cautious with who I give this information to and how I give it. If I see the patient is open-minded and willing to learn an alternative means of improving their health, then I'll pull them to the side and say, hey, you can do this, X, Y, and Z. But typically, I kind of have to stick with what I'm being told to do, unfortunately.
Yeah, I kind of feel like we're like the, the rebels fighting against the Empire, in Star Wars or something.
Right, right.
We're kind of like that. Hopefully we'll have the same outcome where we'll blow up the Death Star and get rid of that low-fat dogma. I don't know. We're gonna have somebody go in there like Luke Skywalker and
Yeah, I
zip
think
it.
the trend is moving in that direction.
I hope so. Yeah, I think we're making a difference, and I see as this community continues to grow and grow. What? Tell me about what are your plans? I mean, what would you like to see? What would you like to be able to do? With either
Hmm.
social media or with your career. I mean, how do you? I mean, if you could say 5 years from now, this is where I want to be doing.
Hmm. Well, it used to be that I wanted to become a nurse practitioner so that I can open up my own independent practice. But actually, I'm considering moving outside of nursing. I'm studying right now to become a health coach. So right now, I'm just focusing on just pumping out as much content and information as I can that people can find value in, and then offering some coaching to clients that need additional help, and just spreading that information, spreading that awareness.
I guess there's some, and I'm not aware one way or the other, but I mean, there's some people in the discussion here asking about raw food versus cooked food. Did you experiment with raw food as well for a while, or do you do that, or what's been your experience with that?
Right. So I started eating raw meat in this past January. I eat both raw and cooked, but mostly raw. And I love it, to be honest with you. I notice when I eat raw, I feel better hydrated. It has a calming effect on my body. Although my digestion was pretty good with cooked meats, on raw it just seems effortless. I can eat a raw steak and I feel like I didn't even eat anything. It just, within an hour it's in and out. Um, yeah, I don't know. I saw some videos on YouTube discussing the benefits of eating raw carnivore, so I figured, let me give it a try. But occasionally I do have some cooked meats, specifically ribeye or pork belly. I refuse to eat that raw. I feel like that's just a waste of a good cut of meat. So I'll definitely cook that. But other than that, yeah, I do mostly eat raw meats.
I mean that's interesting that you say that, and the point you make up about dehydration or hydration is most people, maybe people are aware of this, but meat, like meat is 70% water. So
Hmm.
there's because a lot of animals in the wild, particularly during the dry seasons when they have no access to water, they get their nutrition from eating animal flesh, and that's where they get
Right,
their hydration from that. I
right.
was interesting. The other day I tried a little piece of some of the raw fat because I've been doing the beef fat lately. And I said,
Hmm.
well, I'm just going to try it. I think I can't remember who was telling me, I think it was Brooke here in our community said, so I tried it, threw a little salt on there and ate a piece or two. And it was actually pretty decent. I mean, I didn't mind it. I was
Hmm.
surprised. It actually kind of reminded me of butter. It was just really
Right,
kind of creamy. And, um,
right.
so, I mean, the only caveat and caution I throw out is, sourcing and making sure that, it's not contaminated, because there are definitely people that have gotten sick with pretty significant bacterial infections from
For sure.
raw meat. So it's just one of those things you got to be a little conservative. And just to that point, are there any precautions you take when you do eat raw meat? Is there a way you make sure you're not putting yourself at increased risk for
Hmm.
contamination?
Yeah, so I make sure that it's grass fed, grass finished. Actually, the only meat that I eat raw is from White Oaks Pastures, or sometimes I'll order from another farm that's local, which is Dutch Meadows, and all of their produce is grass fed, grass finished, is frozen right away. Aside from that, I wouldn't eat it raw. Like if I'm going to a local store or grocery shop, I'm not going to purchase their meat and eat it raw because I don't know how that animal was treated. I don't know the hygienic practices of the butchers there.
Yeah, and so because somebody has asked me if raw meat by itself was harmful, and I say no. I mean, if it's contaminated, then potentially, but the raw meat itself is fine. Now, there's some
Right.
concern with different animals, pork in particular, and
Hmm.
different countries have different standards as far as how their animals are raised. Most animals, I believe even the grass-fed ones here in the U.S. still get some kind of anti-parasitic
Hmm.
medication. I may be mistaken on that. And, I don't know if maybe someone can correct me on that, but I believe that's something that we do in the U.S. that maybe some other countries may not do. But most of us here, I won't say all of us, but most of us here are in developed countries where they have at least the burden for parasites is much lower. Do you find, and a lot of people will comment this as well, that if they switch over to raw meat, they don't eat as much. They just don't feel like they need to eat as much. It's more satiating. And I know when I did a week of that, I felt the same thing. I just didn't find it quite as palatable. And so there was that enjoyment. And you make the point about, I don't want to, if I'm going to have a ribeye, I'm going to cook it up, sear it nice, and salt on there because it's so damn delicious. You hate to pass up on that.
Right. I did notice that actually the first time I started eating raw, before when eat a cooked, I could eat a whole pound and a half of meat in one sitting, no problem. But when eating raw, I could eat after 12 ounces, I'm full. And I think the reason for that is because the water's retained within the meat, so it fills you up much quicker. Whereas if you're cooking meat, a lot of that water is evaporated. Another thing that I noticed is that I went maybe 4 or 5 months without salt in any of my foods. Like I didn't eat a single grain of salt, and I just felt like I didn't need it. Even while working out in the gym, I didn't feel fatigue. I didn't get any dizziness at night. I had no palpitations. I had no muscle cramps, none of the sort. And I was actually quite shocked. And I can only assume it's because I was eating the sodium, naturally occurring sodium and potassium that's contained within the muscle meat that would have otherwise been cooked out. But yeah, I definitely cannot tolerate as much meat raw as I can when it's cooked, for sure.
Yeah, and obviously that's a harder thing to sell with the raw. I mean, it's you were already swimming way upstream just trying to get people to eat just meat, and so when you start saying now you got to eat raw, it becomes really hard. But I really appreciate the people that are willing to kind of push the limits here and see, because we're within this community we're getting great feedback because we're learning, and we got people that are doing complete fat fast and seeing how it affects their diabetes, and we're having people that are doing raw, and we're having people that are doing high protein, and we're having people doing all these different variations, and so it's very instructive to learn and see who seems to benefit. Let me ask you about again, back to your social media stuff. What sort of results are you seeing within your sort of sphere of influence as far as conditions that you've seen have improved? Maybe struggles people are having, and some of the things that seem to help that, because it's always interesting to see what we're seeing. And I see a lot of, and I've been looking at this stuff for years now, and I've seen so much amazing things. But what are some of the things that struck you as pretty impressive?
I would have to say most of it is weight loss. I get quite a few messages from people who have lost 50, 60, even 100 pounds since starting the carnivore diet, since starting the keto diet. The second I would have to say is the improvement in mental health. A lot of people tell me, they feel much better about themselves. They feel much happier about life. They're not as anxious as before. Now they have the mental clarity and focus to actually handle their schoolwork or to just, carry out simple tasks throughout the day. A third one that I'm noticing recently is people are able to better manage their blood glucose. They're finding that they don't need as much insulin now that they're not eating, 200, 300 grams of carbs per day. They're noticing that their digestion is improving. A few people have messaged me saying that their joint pains have pretty much gone away. And usually they find out, maybe it's the avocado that they're eating or the spinach that they're eating. And once they remove that, they see a dramatic improvement to their quality of life.
Yeah, and I don't know about you, but I know for me, every day when I wake up, and when I check my messages, sometimes it takes me a long time to get to them now because I'm so busy. But I mean, I am just inundated with positive success stories, and I mean that is so incredibly motivating. Do you find you get the same sort of motivation from that?
Yes, yeah. To be honest with you, I feel much more gratitude and much more fulfillment when I receive those type of messages than what I'm doing in the hospital. Because in the hospital, I feel like I'm just, like you said, managing diseases, managing symptoms, and those same patients, they just come back 3, 4, 5 months later. But when I can physically see someone has, drop their body fat. They're off their statins. They're off their insulin. They're off, these hypertensive medications. And they show me their before and afters, and they're thanking me. Like, I feel much more fulfilled, much more gratitude from that than I ever would just, handing out pills in the hospital. It's two completely different things.
Yeah, I imagine when you were in nursing school and you're like deciding, what do I want to do, and you chose maybe the more acute care route. I suspect it was because you thought you would have an immediate impact. One of the reasons I wanted to become a surgeon was because I knew that I could have a dramatic, rapid effect on people's lives. I didn't really think that we were doing much. I knew when I went through medical school, I saw how abysmally we were doing with chronic diseases, and I was like, I don't have any part of that. But the problem was we didn't know how to treat that. And so was the reason you got steered towards inpatient hospital care is because you thought you could make a rapid difference in people's lives?
Absolutely. I thought I was going to save lives. I spent a large portion of my younger adulthood watching shows like ER and Dr. House and so on and so forth. And I thought I would go into the hospital and do the same thing. And what we're sold in nursing school is not exactly what we see once we start nursing. And I'm sure you know that as well. But yeah, I went into it thinking, you know what, I'm going to help people. I'm going to help revitalize them. I'm going to help regenerate their health. And I would say within the first 2 years, I found it to be the exact opposite.
Yeah, all you're doing is, you get a patient comes in acutely, you kind of put some Band-Aids on so they can kind of, they're not quite as acutely ill, and then you see them back 3, 4, 5, 6 months later with the same problem, only worse. And you really aren't truly making a difference, which is a very frustrating thing. And I wish, and that's something that I do agree. You're sold this dream of you're gonna save lives and make dramatic differences, and you're not really doing much. Very rarely. I mean, sometimes you have occasional big wins, but maybe with some of the trauma stuff. But for the most part, it is just chronic disease with flare-ups, and that is just the sad thing that we're seeing there. Have you converted any of your coworkers to either carnivore or low carb, keto, or anything like that?
I've tried. I've successfully converted, I would say, 2 so far. Only 2. They're very grateful. It took me a while to convince them. I had to show them my before photos because they didn't know me when I was 300 pounds. So I showed them my before and after photos. I scrolled through my Instagram and showed them. I gave them some recommendations of documentaries to watch, and that pretty much convinced them. But largely, my coworkers still think I'm crazy. They're still waiting for me to have that stroke. They're still waiting for me to have that heart attack. They're still waiting for me to just drop dead, I guess. And they're quite surprised that I'm doing the exact opposite for 3 years now.
Yeah, and so I guess we didn't talk about this at the beginning, but you said you started over 300 pounds, and what are you down to now?
Right now, I'm about between 190 195. Oh, your audio went out.
I said, wow, 100 pounds, that's got to be over 100 pounds. That's got to feel just tremendous. I mean, you've got to feel like a new person.
Absolutely. I mean, I remember when I was 300 pounds, I couldn't even bend over to tie my shoes on. I had to do this weird contortionist thing where I would bend my leg and bring it up, wrap it over my stomach just to tie it. I couldn't even bend over and do that because I would be short of breath, or my belly was so big that it would get in the way. I feel much, much better now. Much better.
And again, over what period of time did that 100-pound weight loss occur?
Well, it was off and on. I yo-yoed a lot because I was still addicted to carbs. I would say, all in all, it was within a year and a half, maybe. But I kept rebounding up and down, switching between a sad diet, keto diet. I was allowing myself cheat meals, and that kind of made me relapse into a carb binge over and over. It's only when I adopted the carnivore diet that I've actually had sustainable weight loss.
Yeah, I mean, talk to me a little bit about, because I think that is such an important concept, the difference between keto and carnivore, because a lot of people say,
Hmm.
well, it's just keto with, it's the same thing basically. But talk to me
It's not.
about the carb addiction and why you think carnivore has been maybe more helpful for that aspect versus keto.
Yeah, well, when I noticed when I first switched to keto, I was still allowing myself to eat the same foods that made me obese in the first place, but I was eating the foods that had, that keto stamp of approval. So I was eating keto protein bars, keto muffins, keto brownies, cheesecakes, diet sodas, things of that nature. And over time, I noticed I just replaced my carb addiction with sugar-free sweetener addiction. And a lot of times, consuming these sugar-free products just stoked my hunger. It reactivated my appetite even further, and then I would end up binging on the same carbohydrate foods that made me sick in the first place. When I switched to carnivore, that immediately eliminated all of those foods. I was focusing on real, whole animal-based foods. Over time, I would say within the first 2 months, my addiction to sweetness or sweet tasting foods just completely disappeared. I think part of it was being in ketosis, but also not allowing myself to have these so-called calorie-free foods that taste sweet is what allowed me to overcome that carb addiction ultimately.
Do you find that's the same you're finding with the people you're helping? One of the things that I talk about when I talk to clients is, goal number one is you have to get over these carb addictions, this food addiction. That has to be the first. That has to be the first goal. I
Right,
really believe that. Do you
right.
do you do you think there's some validity to that?
I do. Actually, what I tell people who follow me is that they have to change their relationship with food. You have to stop viewing food as a source of entertainment, although it can be. If you're celebrating, you're enjoying these foods in a social setting, by all means, yes, it can be entertaining. But you have to start viewing food as fuel for the body and not using it as a means of entertainment or as a means to fill a void. Um, and once they start doing that, that kind of eliminates the keto desserts and the keto juices and things of that nature, because they know it's not providing them any real nutrition. It's just a means of coping with their sugar addiction or filling the void, or it's a means of entertainment for them. Once they change their relationship with food, they find no real need to engage in those food products anymore.
What is your stance on dairy? Are you a pro dairy, anti dairy person? Do you find you tolerate it or don't tolerate it?
I'm pro dairy so long as you can tolerate it. I've experimented with kefir recently. I was able to tolerate it pretty well. I actually feel pretty good on kefir. However, because I'm trying to stick to this therapeutic range of ketosis, I'm less willing to experiment with dairy. But yeah, I don't see any issues with dairy so long as you can tolerate it. If you can't, by all means, remove it from your diet.
Yeah, and I just wonder what the experience is. Maybe for some people that maybe check this, does dairy have a unique effect on blood glucose? Even if it's full fat dairy like heavy whipped cream, does that have a different effect on blood glucose than say beef fat or something like that? Have you noticed, been able to look through that and see?
Well, I've read some reports that there's something about lactose, or there's a specific protein in dairy that kind of disrupts ketogenesis and can actually raise your blood glucose. I'm guessing it depends on the amount that you're consuming. But I did read a few reports with that. I did notice that my blood sugar will raise up maybe about 10, 12 points after having kefir, but nothing as dramatic as it would have been had I ate rice or bread or anything like that.
Yeah, and I wonder if that's when you're talking about the uh, you know, and I see Becky commenting on heavy whipped cream, because heavy whipped cream is almost completely pure fat, and then that's
Hmm.
obviously the kefir is going to have a little bit of carbohydrate in there. It's going to have a little bit of protein in there, so it may just be the
Right,
fact that there's carbs and protein and we're doing that. So that's interesting.
right.
I just just wonder if there's unique effects on that, because a lot of people will say that different types of dairy cause inflammatory reactions. Some people have skin issues. Some people have talk about congestion and things like that. Some people tolerate it pretty decently, I think. Let me ask you this question, because it's a little controversial, because obviously you are of African descent, and there's some thought that maybe that, your sort of background would respond differently to a carnivore diet, and we have, a higher preponderance of people that are Caucasian, maybe Northern European, where they may have grown up Ice Age, eating big mammoths, and the thought would be, well, people that sort of, spent more of their time in tropical regions like parts of Africa would be better tolerating a higher carb diet. Do you have any thoughts or opinion on that?
Not necessarily. I mean, lately I've been reading this book called Ancestral Traditions by Sally Norton, and she documents different diets throughout the world. And she actually found that people in the African part of the world actually ate a lot of meat. I mean, the most famous one is the Maasai tribe. They ate raw meat. They drank milk. They drank the blood of the animal. And they were able to tolerate it quite fine. I don't know. I'm not too knowledgeable on, how ethnicity can influence, your ability to tolerate certain diets. But I really think anyone can adapt to a carnivore, or at the very least a ketogenic diet, regardless of their ethnicity.
Yeah, I mean, if you go back really far, and you look at, there's some radioisotope data that came out of Africa about 1.5 million years ago. And this is, obviously before we were Homo sapiens, we were, maybe Homo erectus or some other variation. And they looked at the diet based on barium and strontium levels, and they saw that by and large, those people were very carnivorous, those sort of pre-Homo sapien hominids. So, and obviously there's a lot of meat in Africa. I mean, there's a lot of big animals still, and people still hunt them, eat them. And so, I mean, I would agree certainly that, we all have that capacity to digest and utilize meat. I think it's what made us human beings. And so,
exactly.
But some people say, well, there's different more modern things that have developed, or there's different cultures sort of eat this way, and there's different foods that are in Asia and Africa and South America, and there's different sort of cultural things. Like you said, your traditional Barbados diet, plantains and rice and a little bit of seafood and fruits, and I assume some fruits and vegetables and stuff like that. So it's just interesting because there's different perspectives on that. But I see us all as the same species, and we all have the same basic biochemical needs. And I think meat works well for everyone. But it's good to see people from all backgrounds thriving on this.
Right. I think the carnivore diet is a species appropriate diet, regardless of your race, regardless of your culture. I mean, I think it's the appropriate diet for the human species, Now, if your culture advocates for eating potatoes and yams and things of that nature, and you can tolerate it, by all means, sure, go ahead. But as far as being a human, I think we thrive and operate best on animal-based foods. And history has taught us that countless times.
Yeah, I totally agree. Well, anyway, Jason, this has been wonderful. It's right at an hour. I got to go run and do another podcast here.
Sure.
Thank you so much. Let everybody know where they can find you on social media, or anything else you want to get out there as a message before we go.
Sure. So I am at the Keto Apocalypse on both Instagram and Twitter. Twitter is actually handled Keto Apocalypse. I'm not that active on Twitter, but you can definitely find me on Instagram. And it's been a pleasure, Sean. Thank you so much for inviting me.
Hey, good luck to you, and thank you so much for sharing your story. I'm sure it's going to impact a lot of lives, and keep doing what you're doing. All of us together as a community, getting this message out there, we need to do it. I think the health of our population desperately needs this. We need a new message. We need a new method, and I think we're getting there. So thank you guys so much. I'll see some of you guys back tomorrow. If not, have a great weekend, and everybody take care. Thank you again, Jason. All right, bye-bye, guys.